Welcome to started that too early. Hey guys, welcome to another episode of Tech Tuesday. I hate it when I blow it, and you'd think after I've done so many of these I wouldn't. I know this looks a lot weird. We have a new background, and I am with Josh and Meela. We are actually together at the NIC conference in Nashville. I don't know, I'm trying to think. I'm not sure I've ever actually done a live stream side by side before. Mostly we're in different places. And so I'm really super excited about doing this. We're doing a bunch of video here and talking to a bunch of people. And so it's really great. We're going to get into our conversation right after this. Hey guys, Steve Moran here. Well, Josh, welcome to Tech Tuesday.
Thank you. Thank you for having me.
I want to start with the same question I ask all my guests is, what is the thing that you're passionate about? How are you changing the world of senior living?
Yeah, that's a great question. First of all, thanks for having me on. I am passionate about making the lives of older adults better. I think there are two things that are happening in society today. One is that the caregiver shortage, the ratio of people that are able to deliver care is going down, and the number of people that require care is going up. And as a technologist myself, by background, I've worked at companies like Microsoft and Lyft. Are there opportunities to utilize technology to help bridge that gap? And that's kind of the thesis of the company.
Okay, and so tell me what Meela actually does.
Yeah, that's a great question. So Meela is a voice staff member. So residents call her on the phone, or she will call residents on the phone. And you can kind of think of her as a staff member at a community that can basically do most of the things that any other staff member can do. From talking about the Yankees, for 15 minutes, all the way to helping you fix your broken sink or your broken toilet. She can, put those work orders in, to telling you what's for lunch tomorrow. So most of the non-physical labor stuff that you would be able to get from a human staff member, Meela is able to do.
Okay, so this is on my phone. It's on an Alexa type device, or how does that work?
Great question. So it is literally just a phone call, which is part of the magic of it. So a lot of people interact with Meela through just a phone, rotary dial or landline, flip phone, and you can hook it up so that it connects directly to an Alexa or a Google Home.
Okay, because I'm sort of thinking I need one of these when I'm at a conference like this, right? Yeah. So, like all day long, and particularly because I'm in a different time zone, I'm trying to figure this out. I've got people to meet with, and if I could just pick up my phone and talk to Meela and say, Meela, where am I supposed to be next? That would be huge. And so that's what you're talking about, kind of.
Yeah, basically, it's a AI staff member for these communities. We ingest a whole bunch of information about the community so that Meela feels very contextual to that specific location. She kind of we work with the staff members to kind of train her on what is within her scope and outside of her scope.
Mm-hmm.
And and then we explain to residents, hey, look, you guys are getting a new staff member that will know each one of you individually.
Okay, so I want to talk about sort of two. So it sounds like there are two, or maybe, as I was doing some research, even three parts of this, right? So you've got sort of things like service requests and what's for dinner, what's the next activity, and then you've got conversations, and then there's a whole nother part for the team members to use Meela too, right?
Yeah, that's right. So the first part is, how do we use, AI to automate a lot of these repetitive workflows that senior living operators, caregivers, whoever it might be, are basically stuck behind a computer doing. I think there's a really great example of, when the banking industry initially had tellers and runners that used to go up and down from the safes. And then the ATM came out, and what happened was you were able to displace that labor away from, a teller all the way to more high-touch interactions like loans and stuff like that. A very similar thing is going to happen in the senior living industry, where the repetitive, information like transactional stuff is going to get automated, and then the higher touch stuff is going to deepen and become more human.
Right. So, as I think I understand it, as I was researching it, one of the things that might happen from a staff standpoint is that you might have like all the policies and procedures or those kinds of things. So, if I've forgotten how to do something, I can go to my Meela app and ask it about that. Is that correct?
Yeah. So, it's not an app. You would just call her and you would just say, "Hey, Meela, who's the executive director, or what time does the mail get delivered, or any particular information that's relevant to the community," she'll know.
I really like this so much because one of the things that maybe you've never had this because you're a technologist, so I think you're extra smart, but I forget.
I don't know about that.
I forget things, right? And so it's like I've asked somebody 100 times the same question, right? And then I still can't remember it. And I don't want to go ask them again. I don't want to ask them because I don't want to bother them. I don't want to ask them, probably even more than not bothering them, I don't want to ask them because it's going to make me look stupid or like a bad employee. And with AI, I don't have to worry about any of that.
Yeah, that's right. I think there is a really interesting class of human interaction that AI is actually going to be a little bit better than traditional humans at doing. So, that guilt of going and asking the same question over and over again also causes frustration on the staff side, right? So for the resident, it could be a little bit embarrassing. For the staff, it could be a little bit annoying. These computers have infinite patience, so there is really that opportunity to do some incredible, better matching of information.
Well, another thing I'm thinking is you really got my head spinning on this right now. So I'm thinking I go into a resident's room and I find that they've fallen. And I don't know whether this works or not, but it seems like it could. I could call up Meela and say, Mrs. Jones is fallen. What do I do now? And it would know policies and procedures, but it would also know sort of basic first aid and all those things that could make it much easier, much faster to react. Is that?
Yeah. So
Meela, does that work? I don't know if that works.
Yeah.
I don't want to put words in your mouth.
Yeah. Meela is not designed to give, let's say, medical or financial advice, but what you can do is ingest those policies and help the staff members exercise their job more confidently and help the residents. And also, by the way, for that example, let's say somebody has fallen. How do you do that incident report? Meela is able to transcribe and take off that annoying manual workflow, get all of the information that she would otherwise, someone would have to spend many minutes documenting down into a single phone call, human conversation. Yeah. So that's the workflow side of Meela, where we're trying to remove people away from the documentation. I'm sure if you've been to a doctor's office, over the past 10 years, you'd go there and they'd be typing and typing and typing, and they wouldn't really look at you. And then the scribes came along, right? And then that helped the doctors be more present with the patients. I think we're going to see a similar thing happen in the senior living industry.
Yeah, so it's interesting you say that. Sort of as an aside, right? My dog exactly like that, and for a while they were having medical scribes who were there, and I think I went to some physician. It might have been an urgent care or something where they used AI to listen to the conversation. But right now they seem to have not done anything. They've sort of gone back to the old way of doing that. And the thing I've sort of heard, I think for senior living, it's actually much simpler. But what I've heard from sort of second, third hand from physicians is they've got to spend so much time going back and editing what the AI captures that it's more work than if they just did it. So how do you solve that problem?
Yeah, that's a great question. It's really challenging, right? Because you want to strike an efficiency where you just have it, you say it once and you don't have to review it and do it again. And you also want it to be very accurate. So we work with the communities to basically dial in where they want to be on that spectrum.
And frankly, it just takes time. I use AI when I'm at a conference like this to capture both contact information, but or as importantly, what my follow-up things I need to do. And when I'm all done, I have AI dump out a spreadsheet for me, and then I put it back into a different AI because it works better. That creates draft emails.
Yeah.
And the last time I did that, and I have to go through each of the draft emails to look at them, but I was really surprised the last time I did this that I started looking at my draft emails. They took a lot less work. So it gets better, right?
It does. Yeah. The AI, how I kind of think of it is, AI's core functionalities are getting smarter and smarter over time. And, we don't see any signs of that slowing down, which is a little bit scary. And therefore, the amount of things that the AI will be able to do is going to increase.
Yep.
Right. So, yeah.
That is that's really cool. Now, the one thing we haven't talked very much about is sort of the companion side of things. It's an area where I have really mixed feelings about. To start by saying that, particularly when I'm in my cars, when I use it most, but I talk to ChatGPT a lot.
Yeah.
And I always find myself a little bit freaked out because I start to feeling like I'm having a conversation with a real person. I have to keep reminding myself that this is just a machine. And although sometimes it's annoying like a human, right? Because it'll go, "Are you still there?"
Yeah.
So I wonder first about how it works, and then maybe I'd like to dig into sort of the ethics, and does it replace people? Or I'm sure you spend a lot of time thinking about this.
Oh boy, yes I have. I, like you, also spend a lot of time talking to, Meela in my case, while I'm in the car. So the average conversation length for someone using Meela for companionship is 14 minutes long, which is a pretty crazy statistic. And then we have 14% of people that sign up for Meela for companionship end up speaking to her for an hour or more during a single conversation. And we try and practice a really trust-forward approach to companionship. And we share that Meela is not designed for emergencies. She is not designed to replace human interaction. And she's actually designed to encourage healthy behavior, like socializing, calling your grandkids, or whatever it might be. So, and when you take all of those things and you put them together, and this is a study that we ran out of River Spring in Riverdale, New York, we measured people's depression at day 0 and anxiety at day 0, and then anxiety and depression at day 30 after having 30 days worth of interactions with Meela. And we found statistically significant reductions in both. And we published that in a peer-reviewed research journal, all to say that when you have the right structure and philosophy on how this fits into somebody's life, doesn't replace human interaction, but complements it, it really has the ability to improve people's overall well-being. So, I can walk you through how it works when we go to a community that wants to roll out Meela as a company.
Yeah, I'd love to hear that.
So it's opt-in. So the staff members share, hey, look, we have this new opportunity for you guys to chat with Meela. A lot of, there is something that, the senior living industry has done a great job of is coordinating activities for extroverts, going to bingo, doing exercise classes.
Yeah.
There are not many activities for introverts.
Yeah.
So Meela is really a great option for those people. That keeps their mind cognitively engaged, and like I said, recommends them to be a little bit healthier. And so the people raise their hand. They say, "Yeah, sure, I'll try it." They sign up for some call times throughout the week, and if they don't answer the phone, no harm, no foul. If they answer, they can talk for as long as they want. We cap the conversations at 2 hours to make sure that people aren't further isolating. due to Meela, and it really helps people.
So have you done longer than 30 days?
A 30-day
Days
study.
try as a study, yeah.
We haven't measured depression afterwards,
Okay.
or like after that period. What we do is, as part of our quality assurance and to measure the success of the product, is we have Meela ask, hey, how are you enjoying your conversations at, let's say, 10 or 20 conversation intervals? And then we also have a staff member on our team physically call up some of the users and say, how is it going? So that we get direct feedback.
So are you, as these conversations take place, I'm really fascinated by what the content is. So are you looking at the content, I mean, not like in a creepy way to spy on people, but just in terms of the kinds of things they're talking about? Is it repetitive? Are you able to see changes in health condition, mental conditions based on these conversations?
Yeah. So this kind of gets into the next bucket, which is how do we use the insights of the conversations that people are having with Meela to better direct, resources, care, whatever it might be. So we operate under a dual consent structure, where if the community consents to having the insights from the conversation propagated to them, we will propagate it. And also, if the resident needs to consent to say, hey, I'm okay with some of the insights from my conversation being passed to my care team.
Mm-hmm.
So if Steve, for example, says, my shoulder hurts over the course of a Meela conversation, we can ping a caregiver within 30 seconds of that conversation ending, and the objective there is to really help staff understand, who needs care when.
Mm-hmm.
And then the other beauty and magic of Meela is because she's having many conversations simultaneously, maybe even spread across geographies, she's able to identify trends. So, for example, if Steve, Josh, and Michelle say that the brownies of the community have been unbelievable, for example, what we'll do is we'll send in a weekly email update to the dining director, keep up the good work with the brownies.
Yeah. Well, I like that a lot. And I assume conversely, if Steve, Josh, and Michelle say the brownies are awful and they're dry and I can't stand it, I get that information too.
That's right. Yeah. So we surface positive trends as well as negative trends.
So do you have a sense of what kinds of conversations, what are people talking about with Meela?
The way I describe it is, Josh, Steve have people in their lives that fill certain buckets, right? So, very fortunate. I have a lovely wife. She fills my, love bucket very well. But I might not have somebody in my life currently that I can talk to about the Yankees, for example, or sports. So in that case, Meela might fill that bucket for me. On the other side, especially in the senior demographic, you might just want somebody to reminisce with, right? And when you reminisce, you might want to disclose a lot of, really personal information. You might not feel comfortable doing that with Jerry down the hall. So Meela is kind of a healthy outlet for them to do that.
So I guess I have to ask this question. So is it also designed to uncover depression that might lead to self-harm?
So it's a great question. Meela, how I was talking about those alerts on somebody's shoulder hurting, for example. Meela is also designed to monitor for non-physical things, but mental health.
Okay.
Where we draw the line and we are very explicit with residents is that this is not a way to report emergencies. And there are a couple of things that are, we try and mark them as off limits. So that's medical advice, financial advice, legal advice, and anything sexual. And anything emergent as well. So if somebody ever does express feelings of self-harm, Meela will say, and this is in compliance with national and state regulation, I'm so sorry you're feeling this way. I'm not able to help in this emergency. She directs them to 988, the National Suicide Prevention Hotline, or 911, and says, I look forward to chatting when you're feeling better. And she hangs up the call.
Okay, right. So the other thing we haven't really talked about is as you've described it, it sounds like you're talking about residents who are relatively intact with relatively intact cognition, right? And so I'm wondering, how does it work with memory care?
Yeah, memory care is a little bit different, and the consent, probably does not come from the resident themselves, but comes from a power of attorney or next to kin.
Yeah.
And the focal point of those conversations is not necessarily to have a very deep emotional conversation, because they'll probably be very repetitive in nature, but to more so help the staff abate sundown, right? Or help staff ameliorate some kind of behavior. So the practices around that are a little bit different. And there's definitely value for memory care there, but our core focus has been outside.
So, because this is really very personal to me, my audience knows I'm the family caregiver, the decider for my stepfather who's got dementia. He's in a small home, and his emotional needs are like this empty bucket, and I can visit him for hours, and if I get in my car and drive home, he's likely to call me up and say, man, Steve, I haven't seen you in hours, or days, or weeks, or it's been a long time. And so so I'm thinking about what you're describing, and so I'll give you the other piece of this. Some of his family members put together this book of family history that includes him and his mom and his dad and a bunch of cousins who helped raise him and his grandmother. And I'm thinking, man, if I could dump all of that material from that book into Meela, and then let Meela start asking him questions, because I know that when I read sections of the book or I ask him about stories in that book, he just lights up, and it will keep him going for hours. Can we do that? Maybe. Yeah. I'm trying to talk myself into buying this. I think
we have Meela available directly for direct to consumer.
Oh, is that right?
Okay. Yeah. So you could sign up your stepfather. Right? And I'm sorry he's going through. It's never easy.
Yeah.
So I would give it a try, because anything that helps, and it's another tool in your tool belt, and if it works, it's excellent. If it doesn't work, that's okay too.
Okay. Yeah. No, I mean, one of the things that I have discovered about dementia care, and I sort of knew this, but now that I'm living it, is that, and I was having this conversation with somebody, I think last evening, where when you've met somebody with dementia, you met one person with dementia, and for each person it's so different, and so it's much harder to generalize than a lot of other areas. And so it's a big experiment, right?
That's right. Yeah.
So
one of the reasons I got into this industry is, fortunately, my mother had a stroke, and subarachnoid hemorrhage, deep brain bleed, no fun. And she suffers from, till this day, memory impairment, cognitive impairment. And as you said, every single case is unique. There are no two cases that are identical. And my recommendation is, for caregivers, for families, whoever it might be, you got to try the tools that are out there.
Yeah. Well, can I ask what it costs?
Yeah. So for communities, it's a couple $100 per month.
Okay.
And you get access to all of the workflow automations, and you get all of your residents covered for the companion stuff and the workflow stuff and the insight stuff. So it's really a lot of value there. And then on the direct to consumer side, it's $20 per month.
Okay. And when you're putting it in a community, how long does it take to get it up and running?
Yeah, that's a great question. It depends on the size of the community, obviously, and the makeup.
Right.
So, an AL heavy community will be different than IL. And adoption across those, both of those levels of living are going to be different. In independent living, people are going to gravitate more towards the concierge workflow nature of Meela, versus on the assisted living or skilled nursing side, people are going to gravitate more towards the companion aspect.
Right. And so, I mean, if I had 100 units of assisted living and I decided I wanted to do this, you'd come in and train, and I'd be up and running in a couple of weeks, a couple of months.
It would be
a couple of days.
It could be days.
A couple hours.
It could be days. So
Okay.
that's part of the beauty of the system.
Uh-huh.
There is no walls you need to drill into. There is no, hardware you need to install. Nothing you need to sync. It's just the people and the staff raising their hands and saying, "I want to try it," and then within the day, they're going to be, up and running.
Okay, and then I get a phone number that I plug into my phone, and I'm good to go.
That's right. Yep.
That's cool.
Pretty amazing, huh?
That is pretty. It is pretty amazing. I mean, I'm a big fan of AI. I think AI has so much potential to change human lives. I know there are a lot of people who are afraid of it, who worry about it, and I do think there are some. I think there are some concerns. Privacy is actually not one of the things I worry about, because I assume I don't really have any privacy anyway. But are you getting any resistance at all from people, and what kinds of things do people push back on?
Yeah. So, of course, there is this hesitation about creating a relationship with a machine. And the way I'd kind of break that down is, for the past, since the 1950s, humans have been developing relationships with machines that have been evolving all the way from Pong, right?
Yeah.
You had a couple pixels going up and down,
Yep.
to Pac-Man, where it became three-dimensional, to Sims, where, okay, now you have these life forms that are on the computer and they have personality and all that stuff. And this is kind of the next evolution in that progression. And there's always that initial level of hesitation. I'm sure you probably remember, especially in senior housing, when Alexa came out. Everyone was very,
That's true.
this is crazy.
Yeah.
Why would we ever do this? And now it's kind of one of those things where it's no one even bats an eye.
Yeah.
So I think we're going through that cycle a little bit. And like I said, at the end of the day, people will come around to realize that aging is so challenging, and whatever resources that you can give to somebody to make that process easier is worth giving a try, especially if it has, mental health benefits.
Yep.
Or potentially has mental health benefits. And there's no polypharmacy, right? It's not like you have to take another pill, right, that can interact with your blood pressure medication. This is literally just a phone call.
So have you ever tried, I love these conversations because my head starts spinning about ideas. Have you ever tried Meela as in a group activity, like a group? A simple example would be Would You Rather with Meela, does that work? Have you tried it?
It's a good question. We've had the idea come up before. We haven't tried it. Right now, Meela is designed to be super personal.
Right.
So Steve's Meela, remember Steve's, memories and, conversation history and all that stuff. But I could see how that could be a fun exercise. But, you put the phone in the middle, put it on speakerphone, and play games.
Well, my stepfather lives in a little 6-bed residential community, and all but one resident there has varying levels of dementia. Most of it at his level or a little bit worse. But one of the things they've actually found that works is playing Would You Rather with the residents. And you could, you sit around a table with 5 people, and I've got Bob and Bill, and I'm trying to not use their names, and George sitting here at the table. We'd like to play a little bit of Would You Rather. There are probably other things that would work that could be pretty interesting, I would think. So
it's a good idea. Yeah.
Put that on your roadmap.
Yeah, we should.
So, yep, absolutely. So, Josh, we are about out of time. Let's just talk a little bit about how people can engage with you, who they should be talking to, how to find you.
Yeah, that's a great question. So you can reach out to me directly on LinkedIn or Michelle Saunders, who's our head of growth, and just send me a direct message, and we'd be happy to have a conversation. We partner with communities of all shapes and sizes, and enterprises as well. So
cool.
Yeah.
Josh, this has been a great conversation. Great to be able to do this in person. Thank you for watching. If you're here at Nick, I know you're already in meetings and probably not watching this live, but you'll have to watch this. You should watch it. And if you got something great, we should do a little video together. So you guys have a great rest of your week. We'll be back on Friday with what I know is going to be an amazing conversation about leadership and how to just make your senior living communities be crazy good. Jada, thank you very much for producing in the background. And we'll see you on Friday.
Thanks, everyone.